Welcome to Stem Cell Activators with Dr. Joseph Christiano. Dr. Joe is a naturopathic doctor with over 45 years of experience in natural health. Listen and discover how stem cell activators are helping people enjoy a greater quality of life.
Hi, I'm Dr. Joe Christiano, and welcome to my show. It's so good to have you here because my show, particularly this one, is very informative. I have a young lady that's going to share her testimonial today, and it's all about thyroid and thyroid cancer and the fact that she was already a cancer patient. And so anytime I hear about cancer, and maybe you too, it's kind of a dreary type of topic. In fact, I kind of correlate cancer with death and chemotherapy. And I'll share the reason behind that. But before we get going, I want you to know on the back end of the show, my wife Lori and I are going to talk all about the musculoskeletal system. We're going to talk about the activator for that, and then some testimonials, and maybe even show you how to use the activators and so forth. But while we go through the show, keep a look at the bottom of the screen because all 27 of them will be seen and with their possible application. So if you're not dealing with today's topic, then maybe the topic you are dealing with, you'll see it and identify with it. But when it comes to cancer, when I was 25 years old, I was diagnosed with malignant melanoma, one of the worst cancers you could have. And as a young guy, I went through a whole process of having it removed, have a biopsy done, and have another removal until they got it all. And it's been almost 50 years since then, and I've been cancer-free. But I understand the feeling, the emotion that's attached when you're diagnosed with cancer. But I want to share a personal story about my father. At 78 years old, he was diagnosed with prostate cancer. And the family suggested that he have it removed. And I did not go for that. I did not want my father to have it removed because I believed he would outlive the cancer. It wouldn't spread. He would die of old age before it spread that much, but nevertheless, he had the procedure done. And so they went in, they removed the prostate, sewed him up, sent him home, and said now he's got to go on chemo and radiation because they didn't get all the cancer. And I said to the oncologist, look, you had my father cut wide open. Why didn't you get it all then? No answer. Okay, so anyways, they started the procedure, and my father ended up in the hospital. His vitals are shutting down, and they're going to send him home to die. And I had to tell my father he was going to go home to die. And I sat with the oncologist, and I said to her, my father's not going to go home and die of cancer. He's going to die of starvation because the side effects of that dangerous chemical therapy took my father's appetite away, and I watched my father look like a prisoner from a concentration camp. On the gurney, in his living room, I put my first joint of my finger in his temple to see how much he was emaciating in front of us, day in and day out, and then after 2 weeks, then 3 weeks, and finally my father died. And it wasn't because of cancer, it was because of chemotherapy. Now, I understand chemo works for some people, doesn't work for others, and so forth. What I'm saying here is that there's other options, and the stem cell activators that you're going to hear through the testimony of Kristin, this young lady, and others in the show, and all my shows, give you an option before you choose surgery or before you choose these different types of procedures, these medical procedures, so that you can test them and see if that can't help your body because we go to the root cause. Anyway, we're going to now listen to Kristin and her concern about cancer, her thyroid being removed, and maybe the fact that previously having cancer was going to be spreading through her body. So sit back and listen to this story because it's very compelling.
Last year, it was about July, I had a few weird headaches. So I went to the doctors just wanting to get blood work because I thought probably just need some blood work, see what's going on, if there's anything. Of course, the first thing they wanted to give me was stuff for migraines and everything. But with that, they wanted to also check, because I already had cancer once, they wanted to send me for a CT scan, which I was not expecting. And so they sent me for a CT scan with that coming back as they found nodules on my thyroid. So they wanted to send me for an ultrasound, and they told me that it was a fairly large one, and they were going to send me to a specialist. So they sent me to a specialist. She sent me for a biopsy and it came back suspicious. In the meantime, when I had the biopsy, the radiologist picked up that there was a nodule on the left side also. So they sent me for another CT scan and picked up that one was also a decently sized one. So both were biopsied. Right side was considered suspicious, left side benign. The doctor wanted to remove the right side of my thyroid only. With that being said, I kind of questioned at first, why wouldn't you remove the whole thing with one on the left side that possibly could get larger or whatever. I was questioning the fact that I've already been cut so close to have another surgery in that area. Is there going to be adhesions and then you're going to possibly want to go back in to remove the other side? I said, I feel like that's just a whole lot of surgery to have if we can avoid possibly having two and just doing the one, why wouldn't we do that? So I said, well, I need to know if the left side is growing or if there's reason to remove the whole thing at once, because I'm not going to have one surgery and then come back and you're going to tell me, oh, we have to go back in anyways. She said she was willing to wait to do another ultrasound within 6 months to see if anything changed. They also started putting the fear that it may not even be thyroid cancer, it could be cancer from the first cancer slipping over. So they were giving me even more scenarios of it being a complicated case is basically what they called it. Also, I might throw in there, my dad passed away from cancer at 43. So the risk factors of everything already in there, it didn't really seem like a positive ending per se, but and they really just wanted it out because it was suspicious, and being already having cancer once, they just really wanted to get it out.
Man, that is something just to hear. I mean, imagine this. Now, for 6 months, she's got to sit and wait to see if she has cancer. She already has been diagnosed with a questionable nodule, and then another nodule on her thyroid, and the fact of either having a partial thyroidectomy or a complete removal of her thyroid, and the fact that having had cancer before, is it possibly spreading? This is what she's getting from her doctors and the oncologists, and this is the news that she has to go home with. So that's why, you know, when I think about cancer and that, it is very heavy on the mind because the outcome isn't always favorable. That's why my shows are all about going to the root cause. If we can go to the root cause, or at least test it first, you know, and avoid unnecessary surgeries or dangerous treatments like chemotherapy, which destroys every good thing in the path of trying to stop the cancer, we may be ahead of the game and save us a lot of hardship and things like that. But now let's listen to the rest of her story. I think you're going to find it very, very exciting because she's going to share with you the experience that she had that she wasn't even sure was taking place. Let's listen to her.
My mom is always on to new things, if I can say it like that. It's kind of, if she heard me, a joke between us kids that, oh, mom's on to something new. So she had started the stem cell activators on, I don't even remember how she heard it on the radio, I'm assuming, I think was what she said. And she ordered the first batch of, I believe it was the thyroid one for sure I was on. She was doing the ordering, I was just letting her do the ordering and whatever. But I remember asking her, can you find out if my whole thyroid is removed, is the thyroid stem cell activator something that I could still take that would help naturally? So when she put in the next order, she obviously questioned that for me, which then they explained that there's the ONC and for the cancer one, and to get on that because I had a few months before the next ultrasound to take that and see if that helped. In May was my appointment to basically at least book the one surgery. That was what they had told me, booking the surgery. It's whether or not it's the right side only or the whole thing. That's what it's going to tell us. That's what this appointment was going to tell us. I went to the doctor and she looked at me and she's like, well, looking at the notes and the comparisons to all the tests you had, absolutely nothing has changed from your first scan you had, and that tells me if it was cancer, it would have changed by now. and nothing has changed. She's like, so I'm not doing any surgery because to me it's not cancer. Cancer grows, and cancer would have grown by now. I kind of stared at her and I said, what do you mean you're not? And she's like, we're not doing the surgery. And she's like, unless you want to do the surgery. And I'm like, no, I don't want to do the surgery. See you. I'm like, I'm okay. So I called my mom and I said, they don't want to do the surgery. And she goes, did the activators work? And I said, oh, I didn't even think of that, but maybe they did. I'm like, they must have. I didn't really do any research till actually after I went to the doctors this past time and she said she's not doing the surgery. That was when I actually kind of started researching the stem cell activators. When I looked at even some of the other testimonials on the website, I was amazed that they do actually help people. That must have helped me.
Man, I love that. What a great story. What a great ending to a horrible story, in fact. I guess mama knows best, right? You know, the story tells us that her mother, Kristin's mom, suggested she go on the thyroid activator, and she did. And she wasn't really aware of what was going to take place, but her mom did some research and went to our website and called our office and learned some facts, which is the very same thing you can be doing with my show by calling our office or going to our website, because I'm here to help you. My passion is to help people be healthy. And as I said earlier, if there's a natural option that you can take, I would suggest you take it before you opt for surgeries or chemotherapies in this case and so forth, because we're getting great results. And she gave us a great story. And here she was. Her father had already died of cancer. She previously had cancer. Now she's facing the possibility of having more cancer. So you know her life was upside down for those 6 months. And in the process, she doubled up on another activator, which was the ONC for cancer. It really helps in a very efficaciously with apoptosis, which is helping to destroy cancer cells, and that's really a key feature of that. So the combination of the two, well, the results were they sent her home. No surgery, no suspicious tumor or tumor growth, and she was cancer-free. And even Kristin said, was it the stem cell activators that worked? And I thought to myself, well, if you did nothing else but take the 2 activators and the results were positive, I would say they worked. Well, here's what I want you to understand. When it comes to your stem cells and stem cell activation, which Lori and I are going to talk about shortly, a little bit of insight would help you so that you can make a wise decision. Here's how it works. When it comes to your body healing itself, it's your stem cells that do the job. At birth, we were given our adult stem cells, not embryonic stem cells, but adult stem cells. And the job and duty of our adult stem cells are to go to a damaged area, tissue, or system in the body that has been either injured or damaged, and repair them. It actually repairs the tissue. And the way they do that is it's a phenomenon called differentiation. They actually become that tissue. So if it's a lung issue, the stem cells, your stem cells, become lung tissue. If it's bone, they become bone tissue, and so on and so forth. And that's how it works. But over time, the aging process, environmental toxins and poisons, physical trauma, and your current state of health determine how your stem cells are functioning. And if they're not functioning up to par, then that condition you've been trying to get rid of or you've been medicating for is not going away. In fact, it's lingering, it's nagging, or it eventually becomes a chronic condition. And unfortunately, we end up medicating for that. And we know that medication does nothing more than actually manage our symptoms, and that'll never fix the root cause. So our stem cells, what they do is they signal to one another. It's called cellular signaling or communication. So they, in the process of healing, they communicate. Now, when it's disrupted, when that communication is disrupted, it's kind of like you and me on the telephone, and I'm talking to you and you're listening to what I say, and then we have the static, and now you can't get the message. And that's the same thing that happens with your stem cells and mine, and consequently, the body's not healing, we go the medical route. So what I'm trying to say to you is, this is where stem cell activation comes into play. The stem cell activators, as I always say, they do not heal. They do not repair tissue. They do not make you better. What they do is turn your stem cells back on. In other words, it kind of gets rid of the static in the line, in the communication. They lost their ability to communicate. They lost their capacity to heal and repair the damaged tissue in your body wherever, and consequently, you're living with chronic conditions and medicating yourself and never getting better. So when you take the stem cell activator, it sort of turns them back on, gets the stem cells, your adult stem cells, back to normal function, communication, and they do their job, and that is to repair and heal the tissue that was damaged and so forth. And just like Kristin, the cancer that she was concerned with, apparently the apoptosis of the ONC activator neutralized everything for her, and she never had to have the surgery. She never had the cancer, and that's the results that many people get. Results vary for people because of being an individual, but Lori and I are going to go into great detail now to educate you a little bit more so that you have all the information you need should you incur any type of disease and illness. Hey, this is Dr. Joe Christiano, and this is my wife, Lori.
Hello.
We're glad to have you today. Listen, here's what we're talking about. Osteoarthritis, bone disease, bone density, the narrowing of bone tissue, joint issue, joint inflammation, and so on and so forth. And we've got a really good stem cell activator. It's called OST, which is basically all about bone. So this time we're going to talk about not so much medicating, because we don't believe in medicating, but rather let's go to the root cause. And you probably think to yourself, the root cause, this is bone, how deep can you go? But the osteocytes, they can get damaged. In other words, if you have an automobile accident, or if you play sports and you fall, or you twist your joints, or you bang up your joints, you have a head fall, whatever it is, these tissues, the osteocyte, the bone tissue gets damaged. And consequently, we especially if we go unaddressed, we end up having osteoarthritis and a number of other conditions that only become more painful, and especially in a joint condition, it really makes life very difficult, everyday life very difficult to enjoy. So, Lori, share maybe some of the possible applications that this particular activator does.
I just want to mention that these are all natural. They don't interfere with medications or supplements. They are plant-based, and they do not, there's no negative side effects to taking them. They're very easy to take. Dr. Joe will show you later about how to take them. But what we're talking about now is for OST, meaning osteobone, bone-related issues. And so this one helps regulate intercellular communication and support cellular and tissue regeneration of the bones. Possible applications would be osteopenia, osteoarthritis, osteoporosis, rickets, even fractures, and any other degenerative and pathological conditions. So even fractures, if somebody gets into, somebody breaks their arm or leg, jump on the OST right away. It'll help you heal quicker than just doing nothing else.
I'll give you an example. This young kid was playing football. They had practice, and he got hit, and he had a fractured shin. And so they took him to the doctor, and he said he'll have to be out for maybe 2 months because he couldn't put weight on it. The mom bought the stem cell activator, the OST, for him, and in about 3.5 weeks, he was back on the practice field.
Wow.
Because it was able to, the activator was able to rejuvenate these stem cells that then could help repair the tissue that's been damaged in the bone. And so it's absolutely amazing that we can take something as simple as these drops that are very, very powerful, extremely powerful, with the nanotechnology added to it, which makes them very, very powerful, but yet they're harmless to the body. As Lori mentioned, there's no interaction with drugs or medications or your supplements. Nope. So if you are taking medications for any bone issue or disease that you may have, feel free to start these, because our intention and purpose and hope is that as you take them, you can start to wean yourself off the medications. As we get older, as we age, we start losing bone density. And so now the bones get very brittle and very fragile, and that's why older folks are elders, and that when they take a fall, they break a joint, they break a hip, and before you know it, they're incapacitated. Now they're in a walker, and life comes to a halt, So there is hope now with the idea of taking something that's very natural, and it won't interfere with your meds. It'll get you started in the right direction.
Exactly. Well, we've had people who are younger. They don't have to always be older,
Right.
but people who are very athletic, who, I had a guy who was a tennis player. Well, he's always up throwing up the ball and whipping that racket.
Overuse.
And he was supposed to have 2 rotator cuff surgeries on both shoulders, the right and the left. So he decided to try the activators first. And so we told him, make sure you give it 90 days at least, 90 days minimum. So he started taking them, and he called back like in 3 months later, he called back and said, my right shoulder is back to 100% normal. My left shoulder was back to a 50%. He goes, I am not doing my shoulder surgeries now. He was so excited because we try and tell people, before you even think about surgery, before you even do anything like that, because that's the last thing you want to do is surgery.
Sure.
Try the activators, and there's, we can also help you, direct you on which ones to take based on what condition you're in. You just call our office. But it's always worth trying something like this first before you go into a surgery type condition.
Yeah, and the question people ask a lot is, do I have to take them the rest of my life? How long do I have to take these? How soon do they kick in? When do they, when can I experience something? And we have to keep going back to every case is individual. You as an individual, if I had 2 people that had the same condition, you're both going to respond differently. So it's a very individual thing. But there is a basic thread. The minute you start taking the activators, I'm going to show you how to do it. It's a very simple process. But the minute you start taking them, the activation starts. So in other words, what's intended for this product to do, which is to rejuvenate your stem cells, that is occurring. Now, to get those stem cells that are become dormant, or is already read in the application, the cellular signaling, we have to get these back to normal function, back to par. Then they can start healing. So there's a bit of a process. Some people, we know that in 2 months they felt better. Some in a month, some 6 months, it took them 5 bottles or almost 5 months to get the relief, but they got the relief. But anytime, if you, and here's what happens, when you have a banged up joint, you're going to go through that protocol with your physician, and it's typically, let's do some meds, let's do some maybe some PT and see how you do, come back. But if you're not addressing that root issue, then you're only going to get worse. And then finally they'll tell you, and they give you this death sentence, you're bone to bone or bone on bone. And when you're bone on bone, we'll just say for the knee, for example, you have this cartilage, this very thin material that keeps the 2 bones away from each other from creating friction. But over time, if they wear through and you're bone on bone, every time that joint rubs each other, it's like 2 matches, and it creates inflammation, and now your joint is inflamed. So they're going to treat the inflammation, they're going to treat the symptom.
And the good thing is that they're easy to take.
I mean, simple. You take your dropper. Now, we're talking about doing it in the morning because that's the most convenient.
That's the best time to do it. It's first thing in the morning on an empty stomach.
So simply what you do, we recommend 20, but if the instructions you get pertains to your specific condition, you may take them differently. But here's a single drop, and you just easily squeeze them out until you get to the required amount.
So regular dosage is usually 20 drops. So you put 20 drops in about 2 ounces of water, not a lot of water. And then you put it in your mouth for 20 seconds.
Wish it around.
Swish it, swallow, and then you wait 20 minutes before you put anything in the mouth. So you don't eat or brush your teeth or anything. And that's all you have to do. First thing in the morning is the best time to do it. And we always say, don't give up on trying things. The biggest thing is a lot of times people just go for surgery because it's the easy fix, supposedly. But we always say, why not try these? It's worth trying for a little while and see what happens. And sometimes there's a couple, like the CNT and the OST are a really good combination. CNT is one that targets soft tissue, the ligaments and tendons, with the bone, OST.
That's a great really combination. Yeah, it is. It's very powerful for joint integrity. And when you have an inflamed joint, it could be the tissue, the connective tissue that supports the joint, or it could be the bones themselves that are damaged. So by taking the CNT and the OST, you're addressing both components. And it's a great way to see over time if you can indeed have, the body will do it itself, is repair itself. And if it can, you can forego that potential surgery.
And you know, when we talk about osteoarthritis, osteopenia, osteoporosis, those are degenerative conditions that will continuously get worse if you don't do anything about it. And most of the medications people take just deteriorate your bone even more.
Well, and there's more complications. You got liver issues, you got stomach lining issues, you got a litany of side effects from the medications you're taking. Now, granted, if you are in pain and you can pop a little pill and it takes the pain away, it's probably more likely when it rises up again, you're going to take another pill. But in the short run, fine. But long term, you can't live this way. In fact, you're not living, and then you're going to end up having surgery. And there's no guarantee to surgeries. I've had several surgeries because of sports and really damaging my joints in training and in sports. And some were emergency. I had no choice. But I'll tell you this much: once they open you up, once they do the surgical procedure, you're never the same. You don't return back to normal. They cut through muscle tissue, they cut through ligament tissue, the whole thing, and it never comes back the same. So as an option to avoid unnecessary surgeries or the potential of high-risk surgeries, this would be a very, very sound way of approaching your condition.
We had a missionary who was in her 70s, and she came back from a mission trip. And she needed a hip replacement. She goes, I'm not having a hip replacement, but I want to be able to walk. I love to walk, because she was known to walk all over wherever she went on a mission field. And she's like, I'm not going to do any medications. I'm not going to take pain pills. There's nothing, I have to do something because I'm in so much pain. So she started taking the Activators, and then over the months, she'd call back every time she'd reorder. She goes, I'm getting better. I can feel better. I can feel better. And one moment, she called back and said, I feel fantastic. I'm off my walker. I don't need my cane.
That is so good.
And she's so excited. So we always say there's always hope. Don't give up. But don't look for overnight type things. Look for long results, because it should be happening, even in 3 months, give it a chance to see where you're at that point.
You know, Lori, when I hear that testimony of that woman, that missionary, the first thing that comes to me is a positive attitude. She says, I am not going to have surgery.
Yes.
See, a lot of people will listen to their doctor, and I'm not saying not to listen to your doctor. I'm not trying to give you advice different than what he or she's telling you. But a lot of times we just take their word for it, and we pay the consequence. We've given you these options now, stem cell therapies, PRP, and now the Activators. These are very simple. You can take these at home and so on. But you have to be proactive. You have to take care of your health. You have to take charge, and then enjoy the quality of life that you always dreamed of.
If you would like to order our stem cell activators or Dr. Christiano's book, Stem Cell Revolution, please call 1-800-259-2639 or go to our website at bodyredesigning.com.